Welcome to today's video, which covers 10 warning indicators of stroke in women. Did you know that a stroke occurs in the United States every 40 seconds? However, women are a group that is considerably more vulnerable. Could it be that identifying a minute change could spell the difference between life and death? We go in depth on the 10 most important stroke warning symptoms in women in this video. Knowing these symptoms could save a life, therefore it's not just useful knowledge. We'll also discuss treatment options and prevention actions, giving you the knowledge you need to safeguard your loved ones and yourself. First though, I kindly ask you to like the video and subscribe to this channel. It is very important for us. Thank you very much. Let's start our countdown from number 10. Number 10. A sudden weakness or numbness in the face. People frequently claim that time is money, but any neurologist will tell you that time is brain since every minute matters when it comes to strokes. According to the U.S. Centers for Disease Control and Prevention, stroke ranks as the 6th most common cause of death for women. Abrupt numbness or weakness in one arm, leg, or face is not only an indication of aging or exhaustion, it is frequently a silent warning sign for a stroke. This disease is caused by an interruption in blood flow to certain parts of the brain that regulate sensation and muscular function. Especially in females, as changes in hormones might worsen vascular disorders. In order to detect sudden weakening immediately, check for symmetry by smiling and performing the smile test. In addition, raise both arms to determine if one arm slips lower during the arm test. It is crucial to seek emergency medical attention right once if these tests reveal any sudden weakening. Rapid action can have a significant impact on the result by lowering the possibility of irreversible harm. Next, we'll discuss a different stroke warning sign that is frequently overlooked. 9. Difficulty speaking and mental confusion. Unexpected mental disorientation or trouble speaking and understanding is one of the most important yet often missed symptoms of a stroke. This symptom is directly related to reduced blood supply to the parts of the brain responsible for understanding and language. Studies reveal that women are frequently quicker at recognizing the warning signs of a stroke. According to a 2003 survey, 90% of women and 85% of men were aware that difficulty speaking or abrupt bewilderment are symptoms of a stroke. The language regions of the brain, including Wernicke's and Broca's areas, may be damaged after a stroke. This interference may show up as aphasia. In contrast to common portrayals of stroke, which emphasize obvious and dramatic symptoms, women may exhibit fewer noticeable symptoms. They could experience sudden difficulties following discussions or feel as though words are slipping away as they are going to speak. This perplexity is more than merely forgetting a word. It's as though the regular channels of speech and cognition are briefly blocked. Get someone to repeat a short phrase, such as, "the sky is blue," in order to rapidly determine whether they exhibit this stroke sign. A strong indicator of a stroke can be trouble pronouncing words, understanding tasks, or articulating them. Next, we go more into the less evident, but no less concerning indicators that your body might be alerting you to a medical emergency. How well are you aware of the signals from your body? 8th. Issues with vision. Troubles in vision may be among the initial signs of a stroke. These problems could include abrupt double or blurry vision, or even total blindness in one or both eyes, indicating the need for immediate medical intervention. Visual deficits may occur immediately after a stroke if blood flow is disrupted to the occipital lobe or visual pathways, which govern vision. Symptoms could appear as an unexpected doubling of everything in view, or as an abrupt, curtain-like loss of vision. Cover one eye at a time and note any changes or loss in your field of vision to check for stroke-related visual problems. This can aid in spotting minute alterations that could otherwise go missed until they worsen. It's critical to treat abrupt changes in vision, such as difficulty focusing, seeing spots, or abrupt visual loss in yourself or someone nearby as stroke symptoms. Next, we'll look at another surprising symptom that may indicate your brain is in danger. Do you know that your body's coordination and balance may be warning signs of a major health risk? Let's investigate. 7th. Feeling lightheaded or loss of balance. Sudden onset of dizziness or loss of balance is not only concerning, but it can seriously impair one's capacity to carry out daily chores. These symptoms arise from damage to the brainstem or cerebellum, which control balance, coordination, and spatial orientation following a stroke. Disruption in these areas can cause severe physical disorientation, which may show up as unexpected tripping or difficulty climbing stairs. Dizziness might cause you to feel like the room is spinning, making it difficult to stay upright. Loss of equilibrium may make it difficult to sit up straight or remain motionless without assistance. Try standing on one foot or walking in a straight line as a fast self-assessment. If these basic skills seem abnormally challenging, it may indicate difficulties associated to a stroke. It takes more than merely spotting a stroke to promptly detect these symptoms. It is about avoiding serious accidents or falls that cause these kinds of damage. Although balance problems and dizziness clearly indicate a potential stroke, strokes can cause more than simply these obvious symptoms. What more subtle clues may you be overlooking? Let's investigate further. Sixth, intense headache without apparent explanation. A strong headache that develops out of the blue might be more than just uncomfortable. It might indicate a cerebral hemorrhage, a type of stroke in which there is internal bleeding in the brain. Blood from a ruptured vessel starts to pool inside the skull during a cerebral hemorrhage, significantly raising pressure. The severe headache is caused by this pressure, which indicates that brain tissues are in immediate danger. Patients frequently describe the intense pain they experience as a thunderclap, acute, devastating, and instantaneous, due to the abrupt increase in pressure. These headaches reach their peak severity in a matter of seconds, in contrast to migraines or tension headaches that develop gradually. They may also be followed by nausea or even unconsciousness. It's critical to get medical assistance right away if you or someone else suffers a sudden, severe headache, especially if it feels drastically different from a typical headache. Next, we reveal a typical occurrence that might point to a major problem. Are you aware of how your body responds when it is out of balance? Let's investigate. The fifth is unexpected difficulty walking. Abrupt difficulties walking could indicate a stroke rather than just being clumsy. This symptom suggests that the brain regions controlling motor function and spatial orientation may be affected by the stroke. When this region is affected by a stroke, it becomes dysfunctional and suddenly becomes difficult to walk. An unsteady walk, an abrupt need to hold on to things for support, or a dizziness or sense that the room is spinning are warning indicators to be aware of. These symptoms may result in a person stumbling, having trouble standing up straight, or falling suddenly for no apparent reason. It's critical to understand how dangerous these symptoms are. If the brain's capacity to synchronize motions is compromised, prompt intervention is essential to avert permanent impairment. After discussing how walking can be affected by strokes, let's talk about another mildly noticeable but dangerous symptom that is a key warning sign for strokes in women. Fourth, inexplicable exhaustion. Unexpected exhaustion, defined as an intense and abrupt laziness, might be a subtle but crucial indicator of a stroke in females. This is a deep exhaustion that doesn't go away with rest and doesn't seem to be caused by a simple case of fatigue. This symptom appears when a stroke damages brain regions related to alertness and energy control. The interruption in the brain-body's energy management communication is the cause of the abrupt onset of fatigue, which frequently leaves people feeling mysteriously exhausted. This is not to say that every lady experiencing unexplained exhaustion should run for her life. When symptoms grow so bad that they affect your ability to function, such as when you feel so exhausted and weak that you can't even move out of bed, it's time to seek medical attention. Although exhaustion may cause you to slow down, another stroke indicator has the potential to suddenly change your behavioral and mental state. Keep an eye out as we discuss abrupt behavioral shifts or bewilderment and the reasons they require medical attention right away. Next, we examine yet another crucial sign that may indicate a major health problem. The third is a face drooping or an asymmetrical smile. An uneven smile or drooping face are major medical warning signs, as well as aesthetic concerns. The parts of the brain that regulate the muscles of the face can be particularly affected by a damaged motor cortex following a stroke. This results in a weakening in one side of the face that shows as a droop or an inability to smile properly. These symptoms can be underestimated in severity because they are frequently among the earliest indications of a stroke, appearing suddenly, and perhaps going away just as rapidly. With the smile test, you can rapidly determine whether your face droops. When you ask someone to smile, see if their lips lifts on both sides evenly. A stroke may be indicated if one side rises less than the other. The chance of long-term harm can be significantly decreased with prompt diagnosis and treatment. It can save lives for women who experience more subtle symptoms to recognize and respond to this indication. Next, we will learn about a shocking but frequently disregarded indication that may indicate a stroke. Keep an eye out since what follows could impact how you react in an emergency. The second is unexpected nausea or vomiting that has no apparent cause. Abrupt nausea or vomiting can be a worrying indicator of a stroke, especially if they don't correspond with common causes like a stomach ailment or food allergies. This response happens when the area of the brain responsible for controlling the digestive tract is damaged by a stroke, leading to unanticipated gastrointestinal symptoms. Because they don't instantly point to a neurological event, these symptoms are especially misleading, making awareness essential. Next, we'll look at yet another quiet but alarming sign that your brain may be in danger. Remain vigilant, since this subsequent indication may be crucial. First, a momentary unconsciousness. Syncope, a sudden, brief loss of consciousness, is a dangerous and important warning indicator of a stroke. This symptom happens when there is a brief disruption in the blood supply to the brain, which results in a rapid blackout or fainting episode. During a stroke, a reduction in blood flow to the brain's essential regions that control awareness and wakefulness may result in unconsciousness. This may result in a sudden, intense blackout during which the person may pass out or fall. It's not the same as just feeling lightheaded or woozy. It's a complete yet momentary loss of consciousness. This concerning indication is a crucial signal that prompt medical attention is required. Even a momentary loss of consciousness can indicate a serious disruption in brain activity that needs to be treated right away to protect the patient's safety and stop additional brain damage. As we conclude, changing one's lifestyle and taking preventative action are key to preventing strokes. Monitoring blood pressure, cholesterol, and general cardiovascular health requires routine medical exams. In addition to lowering blood pressure and lowering the risk of stroke, a nutritious diet and regular exercise can help control weight. These are the top 10 stroke warning indicators. Every woman should be aware that awareness might potentially save a life, from abrupt numbness to difficulty speaking. Particular risk variables, such as hormonal fluctuations, highlight the necessity of customized prevention actions and routine medical examinations. Exercise and a healthy diet are essential for lowering the risk. It can make a big difference to know how to react in a stroke emergency. I would now like to know if you or anybody you know has ever had these symptoms. How was the matter resolved? Please share your experiences below to help raise awareness of this important issue. If you're aware of the critical indicators of stroke in women after seeing this video, please show your support by giving it a like, subscribing, and clicking the bell icon. I appreciate you viewing, and keep in mind that acting quickly to identify these symptoms could save lives. Bye.